Millions of Americans struggle with mental illness-related symptoms every year, and the number of people seeking care is trending upwards.
And while May is Mental Health Awareness Month, local organizations work all year round to help those who may be struggling with mental illness. Western Mass News reporter Maria Wilson is getting answers on what local organizations are able to do or able to help.
An urgent warning from top U.S. health officials: mental health conditions are on the rise. Since the pandemic, mental health experts across the country have noticed a spike in the number of people coming into their offices.
The acuity post-COVID has really increased. Some of the concerns I see is that just the level of acuity that we're seeing in kids and adolescents.
Deidre Hussey is a clinical psychologist right here in Western Mass. She tells us resources are struggling to keep up with the demand.
How are we improving care? How are we increasing access across the board?
Half of adults in the 18 to 34 age bracket reported mental illness, the highest rate of any age group. But there are real faces behind these grueling statistics.
We're not alone in this process.
May might be Mental Health Awareness Month, but tackling these issues and offering support to Springfield teens is a year-round job for Tiffany Ruffino and Samantha Hamilton.
The issue of youth mental health is a community issue, right? So the impacts of the youth, the individual, our relationships with one another, and the broader community is something that we have to kind of address.
The Springfield Youth Mental Health Coalition has trained mental health professionals on staff and works directly with the city's young people to give them resources and a safe space.
They're able to share some of their experiences, and then they have their peers around the room saying, yeah, and agreeing with them and sharing their experience. So it really creates an opportunity for them to be able to learn from each other and to be able to lean on each other in times of need.
More than 4 in 10 students reported feeling persistently sad or hopelessness, according to data from the CDC. Many experts are pointing the blame at social media. And with up to 95% of teens on social media, Ruffino says she's seeing the negative impact of it, but it's not a simple escape for teens.
Those platforms can be really great in some instances, and in other ways they, are spaces where youth are able to get bullied. Social media is really one of the things that I think is impacting our young people today.
But Ruffino says the young people she works with are determined to beat the odds.
They're just like, forget the statistics, we're going to beat the odds no matter what, and sort of uplift each other.
And when it comes to the stigma surrounding mental health, Ruffino says teens are tackling it head on.
They are very resilient. They are open to talking about things like stress, anxiety, and depression. And I think the Beat the Odds program provides a safe space for them to be able to do that.
Hussey says open dialogue like this is important.
The more we kind of educate everybody and really talk openly as a larger community and as a larger state or nation, I think that's only going to help us figure out, really identify where the areas of concern are and how do we really problem solve and think about things long term.
In Springfield, Maria Wilson, Western Mass News.
It's important to remember that help is always out there. You can call or text the mental health hotline at 988 anytime, day or night, to be connected with free confidential support.